Welcome to the 2018-2019 Internal Medicine Subinternship. This orientation will give you the information you're going to need and prepare you for the month ahead. The rotation is a 4-week inpatient medicine rotation. In fact, you will be seeing only patients on the inpatient service. We expect you to see and record at least 55 encounters. These don't need to be unique patient encounters. And we expect that over 80% of these encounters will be full participation. The patients you are seeing, we expect you to follow them as long as they're in the hospital, and we expect you to work up at least 3 new admissions per week. You're also expected to work at least 2 weekend days during this month. Now, some of you are going to work with a resident team, whereas others of you will work with one or more hospitalists or inpatient physicians. We also expect you to see at least 80% of the 18 topic areas listed in the syllabus. Now, regarding your clerkship faculty, you should contact them the week before you start the rotation so that you can set up an initial meeting time. But if you don't hear from them by the Wednesday before the beginning of the rotation, then you should contact your clerkship director to help you facilitate this meeting. You're going to be meeting with your clerkship director weekly. Your clerkship director will let you know the date and time of that meeting. We expect you to present a case that you've seen, so be prepared to present a case even during the first meeting of the rotation. Other specific topic areas that are going to be covered during these meetings include procedures, patient safety, and the ethics curriculum focusing on futility. I want you to review the guidelines to oral presentations. That's posted on Canvas, and we want you to limit your presentations to 5 minutes or less. You also need to bring a printout of your patient log every week. Now, each week you're going to present a case you've seen, and the disease of that case should use the following format: definition, normal physiology, pathology, epidemiology, clinical presentation, your management or treatment plan, and finally the prognosis. Now, a little bit about your responsibilities. This is really an acting internship. You're going to be admitting patients to the hospital, and for these patients, you're going to be expected to write a complete history, physical examination, assessment, including differential diagnosis, and a management plan. We expect you to pre-round in your patients, collect lab and imaging data, and be prepared to present these to your attending. You're going to be expected to write daily notes. Some of these notes are written after you pre-round, particularly at the Tallahassee site, and some of the notes are written later in the day, and that's common at the Fort Pierce site. So you're going to have to check with your faculty or clerkship director to find out what the procedure is where you're rotating. Most of you are going to have access to the hospital electronic health record. Other learning really involves self-study, and the texts are the same texts that you use in the third-year clerkship: Cecil's Essentials of Internal Medicine and the IM Essentials text. There is an ethics curriculum posted on Canvas. There's a PowerPoint and readings, and we really want you to incorporate some of these concepts in your oral presentation, including the presentation of the medical circumstance and discussion of of the concept of futility and how it applies to your particular patient. There's a procedures curriculum. We want you to review the material on Canvas. Then there's links to videos as well as readings. You're going to be presenting these procedures to your clerkship director during your weekly meetings, and I want you to review the instructions in the syllabus. And finally, there's a patient safety curriculum. We want you to do a brief presentation of the case, outlining what the safety issues are and how it was or could have been addressed. And this is generally done during the last clerkship director meeting of the rotation. Now, there are 2 assignments for this rotation. The first one, which is to be done during the first week of the rotation, is to identify 3 specific educational objectives within internal medicine that you hope to learn during this rotation, along with a specific plan as to how you're going to achieve these objectives, such as extra reading or following extra patients. You also must list the evidence-based medicine resources you plan to use. This is due by 5 p.m. on the first Friday of the rotation and must be uploaded to student academics. The second assignment is due at the end of the clerkship when you're going to report briefly on the extent to which you met these educational objectives. And that's due by 5 p.m. on the last Friday of the rotation, and it also needs to be uploaded to Student Academics. Now, if you have any concerns or issues during the clerkship, we want you to contact your clerkship director as soon as possible so we can hopefully rectify the problem. There will be a mid-clerkship evaluation usually done around the end of week 2. You really need to keep your patient logs current, and you should take initiative to seek out feedback from your faculty. A couple of important reminders. Remember patient confidentiality and HIPAA at all times. And always remember universal precautions because needle sticks do happen, and you should know what to do if you get stuck by a needle. Now, a little bit about clerkship hours. You're not going to be working more than 80 hours per week, and you will have 1 day off per week averaged over the 4 weeks. The day off is going to be determined by the faculty you work with, but you are expected to be on call with your faculty or the team. We do expect you to be in the hospital about 10 hours per day, and any days off for interviews or whatever must be approved by the normal procedures, and days must be made up. There is no required night call, although in the past some students have found it worthwhile to work with the night float or nocturnist. It's a different learning experience, and if you want to do this, please discuss this with your clerkship director. Resources, make sure all of your mobile device apps are current, and there's a list of currently required apps in the syllabus. A little bit about the final evaluation. I want you to review the grading criteria, which is located on the last page of the syllabus. Each faculty that you work with for a week or more will evaluate you, and we hold professionalism at the highest standard. Any lapse in professionalism, and you will not pass the rotation. So just a few tips for a successful clerkship. Read the syllabus, read about your patients, keep your patient log current, and remember that the shelf exam is primarily focused on inpatient medicine, and IM Essentials is still helpful to prepare for this exam. So finally, read the syllabus. You're responsible for what's in it, and have a great 4 weeks of inpatient medicine. Thank you.